Hospital, Secunderabad. I welcome you all for this grand event and inauguration ceremony of Comprehensive Sleep Clinic on the occasion of World Sleep Day with the theme of Quality Sleep, Sound Mind and Happy World. We want to invite you all.
As we all know, 1/3 of our life goes in, we spend sleep. If you can't sleep well, there are multiple implications in the daytime, whether it is both psychologically, neurologically, as well as multiple systems involved. Since the implications of not having a good sleep is there in every system of body, no single specialty can do complete justice to a patient who is having sleep problems. The sleep disorders are multifaceted and we need a comprehensive approach to diagnose them, evaluate them and treat them. With that, keeping in mind that the comprehensive sleep clinic is started, because the comprehensive sleep clinic will have a multidisciplinary approach towards the sleep. As you can see from the photograph itself, since most of the sleep disorders are related to either respiratory or neurological or psychiatry, the core team will be formed by neuro and pulmo team, which will be instrumental in evaluating the sleep problems. Once we diagnose the sleep problems, then depending upon the severity, depending upon the need, the other specialties are involved. Mainly surgical teams like ENT, bariatric surgery and maxillofacial surgeon, and medical teams like endocrinologist or internal medicine, and the cardiac team when we have congestive cardiac failure patients or electrophysiological abnormalities, and the psychiatric patients for insomnia. All of you know that there is a dedicated sleep lab in our hospital in the second floor. So we will be doing a level 1 sleep study. Wherever there is a there is a neurological defects, a video sleep EEG is also done for the patients, and after interpretation of results, we categorize them into sleep disorders other than respiratory sleep disorders, which will be taken care of by mainly neurology people and psychiatry and psychologists. And when there is a respiratory sleep disorders, whether it is a mild OSA or moderate to severe OSA will be categorized. In overall, the concept is to create a wholesome environment for a patient who is coming with the sleep disorders. Thank you.
With the blessings of Divine God, let's begin our program. I call upon the esteemed dignitaries to light the lamp and ignite the fire of knowledge in us. Requesting Dr. Guru Reddy sir to please light the lamp. Ignite the... I request Dr. Gopal sir, Dr. Sridhar Kasuri sir, Dr. Raghunath sir, Dr. Kukshan sir, Dr. Shailendra Singh sir to please join us on the dais. Dr. Vijay sir.
Everyone, I think around probably it's almost 20 years since I came back from England. After coming from England, within 2 years, I went to Bangalore for a sleep lab for my snoring. So that gentleman did some scoring in the outpatient, and then he said, "Sir, you don't need a sleep lab test." I was very happy. He said, "Your score is so high, you don't need a sleep lab to demonstrate that you got the obstructive sleep apnea." So that bad was the snoring. Then I got operated by Dinda. I got this uvulopalato-pharyngealplasty. So my 4 speakers have become 2 speakers, the stereo speakers. So I know how bad is the snoring and how bad it can affect the lives. And I'm glad that you people coming with a sleep clinic. Good, wonderful. It's glad to have a sleep clinic. Always it's wonderful to have some new concepts which will target the basic needs of the human beings. I think snoring and sleep is one of the important things. I don't know about you, but I am blessed by God that I can sleep standing also. In the queues also I stand and sleep. So God has given me that gift and I'm hoping to retain that gift whole lifetime. So all the best. Okay, thank you.
Sleep disorder is very common. Actually, in cardiology, one of the major problems. Sleep apnea is one of the most common cause of resistant hypertension.
We all know why the sleep study is important. Sleep study is important to diagnose pulmonary problems and the neurologic problems, some other psychiatric problems, and also epilepsy. The most important reason we do the sleep study is the OSA, obstructive sleep apnea. Other than that, certain other neurological conditions. Most commonly, the conditions which we do the sleep study is the restless leg syndrome, narcolepsy, and REM, sleep behavioral disorders, and certain other sleep behaviors. You all know that somebody behaving abnormally and shouting in the middle of the sleep. All these reasons we do the sleep study. Apart from that, certain epilepsies where we are not sure whether it's really a seizure or certain other behavioral disorder. To decide upon it, we also do the sleep studies.
So need for a sleep study from neurology point of view, restless leg syndrome, circadian rhythm disorders, excessive daytime sleepiness, insomnia, narcolepsy, parasomnias, periodic limb movements, sleep apnea and epilepsy. All these things we definitely need a sleep EEG along with a video monitoring and a sleep study. That is the reason and motivation for us to start the comprehensive sleep clinic. So my take-home message to one and all is that your body needs adequate sleep on a daily basis. Lack of sleep can make you less alert and affect your coordination, judgment and reaction time both while driving or operating, and thus results in your cognitive impairment. So our vision basically here is a world where everyone gets sufficient sleep. Our mission is to raise awareness about the sleep insufficiency, sleep disorders and importance of sleep health for the overall well-being of everybody. Our goal here is to cater a comprehensive sleep evaluation and treatment at our Sunshine Comprehensive Sleep Clinic Center. Thank you for giving me this wonderful opportunity.
Encompasses the following syndromes: obstructive sleep apnea, hypopnea syndrome, obesity, hyperventilation syndrome, central sleep apnea with Cheyne-Stokes respiration, primary central sleep apnea syndrome, and upper airway resistance syndrome.
So I congratulate the pulmonology and neurology team to take the initiative. This is a very good thing. So involve all particular specialties.
Briefly, regarding the ENT point of view, we divide the upper airway into 4 levels. So level 1 is nose and nasopharynx. So any structural abnormalities like a simple deviated nasal septum can cause a primary snoring. No need of any apneas or anything. So without sleep apnea, no snoring, only snoring is there. We call it as a primary snorers.
To finish, I thank everybody.